Hello, my name is Scott McClellan and I'm with Plant Moran Group Benefit Advisors. I'm going to speak about the employer shared responsibility provision of healthcare reform. Effective January 1st of 2014, all large employers, those with 50 or more full-time and full-time equivalent employees, will be required to offer all of their full-time employees, those working 30 or more hours of service a week, and their dependents, an opportunity to enroll in at least one health plan that provides minimum essential coverage, that provides minimum value, and is affordable. Otherwise, the employer is potentially subject to a penalty. This provision is commonly referred to as the play or pay mandate within healthcare reform. Technically, all full-time employees means at least 95% of the employer's full-time employees. And minimum essential coverage, from an employer's perspective, effectively means an employer-sponsored group health plan. So, if an employer currently offers group health care coverage, they need to make sure they continue to offer coverage to at least 95% of their full-time employees, or they're going to face a potential penalty. However, even if the employer does offer coverage to at least 95% of its full-time employees, they could still be subject to a penalty if the plan they offer does not meet some minimum standards. First, the plan must provide minimum value. A health plan provides minimum value if the plan's share of the total allowed cost of benefits provided under the plan is at least 60% of such costs. So mathematically, employees would be responsible for the remaining 40%. And that 40% is going to consist of things such as deductibles, coinsurance, co-pays, etc. An employer can use one of three methods to determine the value of their plans. Most employers will be able to use either the minimum value calculator that was recently released or a safe harbor checklist that is yet to be released. If neither of these tools work for a particular employer, that employer would need to hire an actuary who will be able to calculate the value of their plans. Second, the plan must be affordable. A plan is affordable if an employee's share of the premium for self-only coverage for the lowest cost plan that provides minimum value does not exceed 9.5% of household income for the taxable year. Since it may be difficult for an employer to determine an employee's household income, recent guidance included three safe harbors listed here. Generally speaking, if an employer does not provide minimum essential coverage or an employer-sponsored group health plan to at least 95% of its employees, they are subject to the no-offer penalty, which is $2,000 per full-time employee minus the first 30 employees. This penalty is only triggered if at least one full-time employee purchases subsidized coverage through a public exchange. Employees earning 400% or less of the federal poverty limit will qualify for some type of federal subsidy. If an employer does offer coverage, but that coverage does not provide minimum value or is unaffordable, that employer is subject to a penalty that is the lesser of $2,000 per full-time employee minus the first 30 employees, or $3,000 per employee who subsequently purchases subsidized coverage through the exchange. If an employer offers coverage that meets both the minimum value assessment and the affordability assessment, the employer will not be subject to any penalty. Likewise, their employees will not qualify for subsidized coverage through a public exchange. I hope this session was helpful and provides you with the guidance needed as you consider benefit strategy for 2014 and beyond.